Candice Langford, pelvic and sexual health physiotherapist, and this is the Nurture Pod. We are talking pee, poo, pleasure, pain, periods, pregnancy, postpartum, peri, and postmenopause. All the P's, all supposedly taboo, yet essential to our holistic health and well-being. We are shining a light on each and every one of these, both confidently and comfortably. Let's get curious. Pregnancy and postpartum is often romanticized as this perfect and beautiful time of life. But the reality is, this time of consistent change can be terrifying and intimidating, especially when we start to relate it to intimacy. This is why we have brought in Sharmon Reddington. She's going to be sharing with us tips and advice from her clinical experience. I can assure you that whether you are planning for this time of life, if you're in it, or if you have been in it, that these tips are going to be valuable for you. But first, one of the most common questions that comes my way is how to have better and more satisfying sex. Although this is multifactorial, I so value the potential of erotic audio content to pique mind and body arousal. The audio app Guided by Glow aims to do just that. Their guided sexual meditation journeys gives you the space to slow down, relax, and connect you to your senses, your creativity, and of course, nurture your relationship to pleasure as you drop deeply inside the feeling body. Listen until the end of today's episode for a special gift from Guided by Glow. Okay, so Sharmon is a registered psychological counselor with a special interest in perinatal mental health. She has 2 little ones, 4.5 and 2 years old. Sharmon experienced pregnancy and postpartum to be incredibly empowering, but also very hard. Through the work that she does, she realized that she is definitely not alone in experiencing motherhood or parenthood as this paradox. As a practitioner, she considers all the unique parts of you as a parent or as a mom. Her primary goal is to help guide and support you in navigating the challenging parts of pregnancy, birth, and the postpartum period. Her focus in therapy is guiding to connect you to yourself and to feel confident as the wonderful parent that you are. Thank you so much for being here today, Sharmon.
Yay,
Okay.
Thanks, Candice. I'm so excited to be on the Nurture Pod.
Woohoo! I'm so happy to have you here in season 1, Nochal. Okay.
Yay.
So let's get to this question because I'm so excited to hear what your answer is. As a counselor and with your clinical experience with pregnancy and postpartum individuals, can you offer advice or tips in relation to maintaining intimacy in this period of life?
What a question, and such a valuable one. So I think first when we look at the perinatal period, so pregnancy to the first year, that experience is such a raw and vulnerable experience. And I think, probably one of the most vulnerable experiences that we can go through as a mother and also as the partner. And this is physically vulnerable as well as emotionally and mentally. And I think that vulnerability is a birthplace for so much courage, but it also can be the place of fear and loss of trust. So during this very vulnerable transition, I think one of the first tips I would highlight is the compassion for that time. And the kindness to self that what we are going through is raw, is vulnerable, is challenging, beautiful, empowering, yes, but an experience that is like no other. So the first thing there, I think, would be giving the kindness, the compassion through the experience that you're going through or your partner's going through.
Yeah, oh my word. I think if people are writing down tips from this, just already the words that you're using are so beautiful. So acknowledging this as a transition and just saying to people, identify where you're at, and it's okay. I just love the words that you've used thus far, and it just goes to show why I really wanted you on this podcast, because you speak so beautifully and you're so full of pearls of wisdom. So please, you carry on, because I will go on a tangent or two. That's number 2.
So let's go on from the transition. And those that sort of are aware of me and my work, my page, or know it's one of my favorite quotes. But essentially looking at the mother as being something absolutely new. So the woman existing before, but the mother, until that child's born, the mother didn't exist. So the mom is something brand new. And when it comes to intimacy, I think one of the biggest focal points is getting to know this new woman, getting to know this new mother. And as she is so new, finding out what does she like? What does she not like? What does she need? What makes her feel good? What makes her feel uncomfortable? And really taking the time to get to know her. And this could be sort of through emotional practice, journaling. It could be through therapy, talking to loved ones. It could be physical, moving her body, getting to know this new body, getting to know the changes, and not running away from the new body. We don't have to necessarily love this new body, but accepting that this is my vessel now. This is my body, and let's explore it. And then, of course, there's room to explore intimately, self-pleasure, and finding out, with these transitions, these changes in hormones, perhaps physical changes to the vulva, to the vagina. What do I like? What is going on here? Let me get used to this new mom, this new person.
Amazing. Yes. And just two things that you've brought up there. So body positivity, it's a really beautiful thing to acknowledge, but we also can see a movement towards this, what people call body neutrality, as opposed to body positivity, because it can kind of be a little bit nauseating sometimes, because you don't always just love everything so much. So, and like people say, enjoy every moment. You're like, at 3 o'clock in the morning when I'm breastfeeding, I'm covered in vomit. Like, I'm not enjoying this moment, and that's okay. And the same thing applies to your body. Like, you don't have to be overwhelmingly positive about it, but like what you're saying, we just need to acknowledge where you've come from, where you're at, and be appreciative of this amazing achievement that your body has come through. And then another thing that you've brought up in relation to kind of getting to know self intimately through this period is, as we often see, your preferences for pleasure can change, and that's okay. It's good that these things change, and it's wonderful to get to know yourself through these different life phases, because you might have, for example, previously found your breasts are incredibly erotic, but in this period, and I'm sure that you've seen this with your clientele, the pleasure associated with your breasts change, because you feel as though the role of your body in this area has not changed. So it's getting to know that, and not inflicting this kind of self-blame as to, like, why is this no longer pleasurable? Why don't I, have the same role? Why do I have to tell my partner, no, don't touch that, when he knows that that's my pleasurable area of my erotic area of my body? So really, really valuable tip, and getting people to just see where you're at, and be okay with the changes that come in this period of life. Amazing. Thank you. Oh.
Speaking of, and I could relate to that on such a personal level, with sort of breasts, nipples being erotic, and then serving another purpose in breastfeeding, and then adjusting to once what was maybe erotic to now being more purposeful in feeding an infant, and then stopping breastfeed and readjusting. And I think so many of our zones, parts of our body, go through that transition of being pleasure, sexual, to being nurturing, to being then back to, and absolutely, Candice, I think sort of acknowledging what those parts of my body was like prior and now post.
Yeah. And all with curiosity. It seems like curiosity just seems to be this thread that has kind of come through a few of my podcasts thus far. Is just doing it curiously, without a sense of blame, with no pressure, with no expectation for a certain outcome, just exploring, like you say, self-pleasure curiously, like, oh, that used to feel really good. Right now, I don't really like the feeling of that. That just feels weird. Let me try something else. And just going with the flow with that. But shame. Let me let you carry on with your number 3.
So speaking of breastfeeding, and I think it really is such an important part to have a look at, is the giving nature of pregnancy, birth, and postpartum. And so much of that, and this isn't to shine a negative light on the perinatal period at all, but to acknowledge that it can be physically and emotionally taxing, giving. As we grow a fetus, our body sends a lot of energy to the growing baby. So pregnancy can be experienced as a physically laborious task, right? Then going through birth, we give birth, whether vaginally, C-section, there's a process of your body giving again. If mom chooses to breastfeed, there is our body again is giving. So I think when we look at a term called touched out, basically meaning the whole day we have been physically touching. We've been holding, cradling, nursing, protecting, cuddling. At the end of the day, physical touch might not be the thing that's going to lead to intimacy. We might feel absolutely touched out. So I think in developing that intimacy and prioritizing intimacy postpartum, one of the things is perhaps to change the giving to receiving. So not looking at intimacy as what do I have to give, but what would I like to receive? So maybe that isn't physical touch. Maybe that's words. Maybe that's sort of emotional conversation. Maybe that's alone time. And there's no shame in that. Maybe intimacy for you for right now isn't with another person because that feels too much. Maybe it is on your own, in peace, in quiet, which is something a new mom probably doesn't get a lot of. So changing that dialogue from giving to receiving.
Oh, amazing. I'm interjecting so much in this episode, but I think it's just because I really, really love the content that you're sharing and I'm relating to it a lot. And I've seen many of these points in the patients that I've worked with. But you're talking about being touched out, and I absolutely see it in pregnancy, postpartum, in this different phase of life. But I've also actually seen, and this might be something that it is something that I would love to introduce in a podcast coming up, is individuals that have not been pregnant or do not have children or whatever phase of life they may be in. Some people are sensory sensitive, and those individuals often feel a sense of sensory overwhelm just from the noises of the cars going past, the feeling of your clothes on your skin, the wind on your skin, the busy room that you might be in. All of those things can also be quite sensory overwhelming. And now if you've got a partner who is on the other side of the spectrum with regards to sensory sensitivity, they may be the type of person that's like continually tapping their foot, and they're looking and they like loud music and they like busy patterns and clothes and bright colors. Those people are typically kind of sensing more sensory input, whereas you're the type of person on the other side of the spectrum that's like, everything's so overwhelming, I just want a beige room and very light lit lights. Anyway, so what we often see in these individuals is that if you're already feeling sensory overwhelm, and then here comes your partner and he likes to kind of push you into the bed and grab you really tight, that can make you feel super touched out. If you've had a busy, overwhelming, sensory sensitive day, and then you've got this patient that's this partner that's very sensory seeking, and they just on the other side, it can be super overwhelming. So if you're kind of listening to this and you're thinking to yourself, I also feel touched out, but I'm not a mom or I'm not a parent. Like, why is that me? This might be why. It might be because you are sensory sensitive, and we will most certainly discuss this with an OT in an upcoming episode.
Yeah, absolutely. 100%. I think now that hearing you say that, I probably experienced to be feeling touched up before even becoming a mom. I hadn't looked at it in that respect, but absolutely. So agree with you. I think the next sort of little tip to have a look at is maybe a controversial one, but the motherhood myth, or the patriarchal view on motherhood, and that sort of being that all women want to be moms, all moms love every minute of being moms, and all moms find motherhood natural. And I think obviously with intimacy being both emotional, psychological, physical, mental, having a look at that, because if we go into motherhood with those notions and we feel that that's what is expected of us as a mother, then feeling slightly different can lead to so many feelings of guilt and shame. What's wrong with us? What am I doing wrong? I'm not a good mom. When really what you're experiencing is so normal, but maybe not spoken about in the same regard. If and have seen this with myself and see it with clients as well. If we're feeling guilt, shame, overwhelm, the chances of us investing time in intimacy is probably slim. Because what we're going through at the moment feels so much, there's little capacity for finding room for intimacy as well. So I think looking at sort of the motherhood myth, those feelings of guilt, is definitely one thing to work through, to speak about, to try and understand, connect on, as that might be a block into finding space for intimacy.
Divine, yes. So, I mean, this sounds like the perfect opportunity for people to come and see a psychologist such as yourself, someone that's got experience in this field and they really understand the relationship that individuals may have with this motherhood picture that we see on social media, etc. And if you feel like you don't connect to it, it doesn't mean that you're broken. It just means that you're different, and we're all different, and that's okay. And just start acknowledging and accepting that and working with you, as for example, of how to do that. It's beautiful.
Yeah. And I think probably the last one that I would like to share with you is the notion that moms aren't just moms. I said this myself. I felt this sort of the mom role feeling all encompassing, and that's all I have space to be as mom. And again, I think there is a pressure, perhaps a societal pressure, that we are ill-informed or maybe suggested that to be a good mom is a mom that gives all of ourselves. So everything is given to our children, and then we're a good mom, which can't be further from the truth in my opinion. But I do think it affects intimacy. You know, when we feel that our role is to be a mom, perhaps there's no space to be sexually aroused, to enjoy intercourse, to enjoy intimacy, to enjoy self-pleasure, because I'm a mom. All I can be is mom. There's no room for that other side. And I think that's something that we do a disservice in, is believing that the only thing we can be is mom. Of course, it's an integral role. It's a huge part of us, but it isn't all of us. And if intimacy, intercourse, sex, self-pleasure is something you want to bring more of into your relationship, but a feeling that as a mom, I can't do that because my role is to mom, I would really encourage you to try and reframe that for yourself, and have a look at allowing yourself to be more than just the role of being a mother.
Oh, I think that is so valuable. Do you have like an example or a tool that someone might be able to use, like whether it's writing it down or whatever it may be, so that, because I think that's a really important point for people to start their journey, is potentially just kind of like you said, reframing. Do you have any tools on reframing that you could share possibly?
So I think when we sort of do that process, and obviously it's a lot easier said than done, but speaking through those ideas out loud, and a lot of us hadn't or don't do it, but sort of what does a mom look like to you? Is that your role? Is it a part of who you are? What are the other parts of you? What do you enjoy? What would you like to bring more of? What is intimacy to you? And starting to explore those questions either with a therapist, with a person that you trust, or journaling, and in that process sort of writing down, or speaking out and understanding more of those things.
Amazing. So I think, if I understand, like a valuable thing for people to do would be really to reflect on it, on the role, where they want to be, what they see themselves as now, and then obviously reaching out to someone such as yourself if they are still struggling. Sure, Sharmon, this has been I'm loving this, and I'm sure that many listeners are going to really find so much value in what you've shared thus far. If I can ask you, you are done with your tips, am I right? Your points.
Yes.
Okay,
I
wonderful.
think I'm done.
No, you've shared a lot. I just wanted to make sure before I went and cut you off. Okay, so Sharmon, if you can just summarize those for those of us that potentially don't remember the titles, because it'll just really refresh our memories. And if anyone is quickly scribing down, this might help there. So if you can just summarize for us the points that you've shared today, and then tell us where can people reach you, how can we get in touch with you, how can we keep following you and listen out for more of your pearls of wisdom, no matter what our phase of life may be, but like you say, specifically in the perinatal mental health space.
Awesome. So, quick recap. Obviously, acknowledging that the perinatal period can feel extremely vulnerable, can feel raw, and honoring ourselves with self-compassion and kindness during that period. And then having a look at sort of the physical laborious or the taxing components of giving, creating life, giving birth, feeding, nurturing, and then encouraging us to look at the receiving side of things so it doesn't feel like a constant giving. And then getting to know this new mother, this new woman, this new person, this new parent that you are. As I said, you didn't exist before having the mother didn't exist before having the child. So getting to know physically, emotionally, mentally this new person that you find yourself as, and then trying to challenge some of the myths, the motherhood myths that we may believe or may have felt were the only ways to mother, and rather having a look at not how we should mother, but how we would like to mother, and finding sort of our roles outside of being a mom. And then you can find me at MomWell. Instagram is probably where I'm most active, and there you'll find other ways to reach me, to work with me, or to just follow along for some psychoeducation.
Divine. And that's MumWell, MUM, for anyone that is listening. Sure, Sharmon, I'm so grateful for your precious time. Thank you so much for being so generous with the amount of information that you've given. I really feel that these tips, these different topics that we've been through are going to be valuable tools in helping people to get started, helping people to identify and acknowledge where they're at and what they can work on, and then hopefully make the adaptations that they may need, to reaching out for help, asking a friend, or just, seeking community support wherever it may be, as well as obviously following you on Instagram.
Thank you so much, Candice.
It is such a pleasure having you here. Thank you, love. Have a beautiful day ahead, and beautiful day to everyone that's listening. Well, NurturePod listeners, until next time, please review and subscribe, and as always, stay curious. As a special treat for listening to today's episode, you can head over to the nurturepelvichealth.com website and use the code NurturePod for 20% discount on all pelvic and sexual health courses. And now, let's indulge in a gift from Guided by Glow, whose mission it is to create a transformational practice of awakening your sensual feeling body, igniting your imagination, and cultivating a positive and thriving sexual relationship with yourself. Try today and take $20 off your annual membership using promo code NURTURE. Go to guidedbyglow.com or find it in the App Store.